In this video, we will be discussing about neurally mediated syncope. Neurally mediated syncope occurs due to increased vagal tone and decreased sympathetic tone. Means in the reflex arc of baroreceptor reflex, we know that here are the baroreceptors. Here is the nucleus of tractus solitarius, and here is the nucleus ambiguus, and here is the CVLM. CVLM increases the sympathetic tone and nucleus of tractus solitarius increases the vagal tone and NTS decreases the vagal tone. Right, let me select the pencil in here. Nucleus of tractus solitarius. It decreases the vagal tone, right? And CVLM, caudal ventrolateral medulla, it increases the sympathetic tone. Now, what happens in this neurally mediated syncope is that there is increased vagal tone, means this is inhibited. There is decreased sympathetic tone, means this is inhibited. So, it is a part of reflex arc, which is less activated or which is inhibited. So, there is basically inhibition of the baroreceptor reflex. For this inhibition of the baroreceptor reflex, there has to be present a functional autonomic nervous system or this autonomic reflex arc. This arc has to be present, means the autonomic nervous system is present, but it is disorganized. It is not activated properly or appropriately. It is inactivated inappropriately. That is why there is increased vagal tone and decreased sympathetic tone, which decreases BP, which causes syncope. Now, what are the causes of this kind of pathology of this autonomic nervous system? The causes are divided into two. One is called as situational stress syncope, which is pertaining to the organ systems. The other is the vasovagal syncope, which is not attributed to one organ or one specific organ. For we cannot make some organ system responsible for it. It is primary in nature, right? The causes of vasovagal syncope are provoked fear, pain, anxiety, sight of blood, or orthostatic stress, right? Situational stress response means there is some situation underlying. It can be pulmonary, cardiac, urogenital, GI, right? Carotid, sinus, ocular. This is the causes. These all causes are meant to be remembered only. Uh, we cannot go into detail of every particular entity in this category. For example, in pulmonary, we can remember the cough syncope. Some people cough and then they faint because of activation or inactivation of the baroreceptor reflex. Urogenital post-micturition, GI post-defecation can be seen in glossopharyngeal neuralgia also. Rectal examination के टाइम पे भी हो सकता है. Swallow syncope, खाना खाने के बाद या खाना खाते टाइम आदमी बेहोश हो सकता है. Cardiac, Bizold Jerich reflex. This is a very famous reflex. Cardiac outflow obstruction, right? Carotid sinus massage, ocular pressure, ocular examination, ocular surgery. These all are the causes of situational stress syncope. There has to be some situation underlying. Treatment of this vasovagal syncope is, first of all, this is not lethal, this is not fatal, this is not very dangerous. So first of all, we have to reassure the patient that it is okay to to have this vasovagal syncope. It happens sometimes. Sometimes your baroreceptors doesn't work. Sometimes your machine doesn't work. Machine doesn't work. Sometimes, occasional, once in a while. If it doesn't work, there may be syncope. So first of all, reassure the patient. Second is education. Tell the patients that why this occurs. Can it occur again? Is it lethal? घबराने वाली कोई बात है? हो सकता है दोबारा होने का कारण क्या है? और इसको ठीक कैसे करना है, ठीक करा जा सकता है, बड़ी आसानी से करा जा सकता है, ये बताना पेशेंट को। The third treatment option we have is we have to avoid the provocative stimuli. That is very, very important. Some people they faint at the sight of blood. Some people they faint when they are anxious. Some people they faint when they are fearful. So we have to avoid those situations in order to not to get faint, not to have a syncope. Then, as far as pre-pharmacological measures, other pre-pharmacological measures are concerned, it is the plasma volume expansion with fluid and salt. ज्यादा पानी पिए, नमक वाला पानी पिए, नॉर्मल सेलिन, नॉर्मल सेलिन को हम इन्फ्यूज कर सकते हैं या नींबू पानी पिए। The fifth is the isometric counter pressure maneuvers of the limbs. Ask the patient to tense the abdominal muscles, which are very much effective in treating this syncope, or when they feel that they are going to have a syncope. Just educate them that you have to do the abdominal muscle tensing if you feel like so. So they can do hand grip, they can go do leg crossing, they can do leg muscle tensing. That is what they can. As far as pharmacological measures are concerned, we can treat the patient with fludrocortisone and vasoconstrictors and some beta blockers. They are also widely used by experts. Why beta blockers? Because heart rate increases in vasovagal syncope. We have to inhibit this. That is why we use beta blockers, right? So फ्लूड्रोकॉर्टिसोन समझ में आता है, vasoconstrictor समझ में आता है. Beta blockers are difficult to remember, but as it is written in Harrison that heart rate increases. In order to prevent this, we give beta blockers, and this will inhibit the whole of the reflex arc. तो faintness या syncope नहीं होगा, right? So this was all about neurally mediated syncope. I hope you understand, and yeah, that's it.